right, so we are back. Hi, guys. We are back again with a short break. Thank you, Dr. Gaurav, for taking the time. Before the break, we were talking to you about some challenges that young medical professionals and medical students are potentially facing, right? We did cover issues with
Yeah.
choosing their preferences, choosing what field they want to go for, the political scenario, the changes that are coming up with their exit exams, and also with choosing their PGs directly versus getting an internship and some experience first. The digital world where we are, where everybody is just focused on getting their exams and preparing for exams online through tutors, and then not actually spending time engaging with their patients, and not actually spending time engaging with other doctors or collaborating with them or learning from more experienced people. And there are also some challenges with poor literacy around financial management, and or around legalities of being a doctor, right? So we were talking about what are some issues that young doctors face when they just focus on exams instead of actually getting experience before their PG, right? So
Yeah.
what do you recommend for them?
So, like we were discussing, the major change I would like to see is that when they enter their MBBS, they first get clinical postings in each and every subspecialty or department of that particular year. For example, a first year student who goes and enters the first year, he when he has an anatomy posting, there are micro batches of maybe 5 to 10 individuals who go in the anatomy lab, stay there with one of the tutors or teachers along for one cadaver, and learn the dissection of every part or organ of the cadaver. And in the same way, I would subspecialty be dealt with like that. So suppose a particular student has a surgery department, then he is allowed to scrub along with the senior surgeon, and at least he is allowed to assist or hold basic instruments, and at least get a knack of that, of the operating table, of how the surgery goes, and so on. Similarly, in the pediatrics department, they are just left open and allowed to deal with the children, how to convince the small children to get a cannula or a vaccination. So in this way, if organically each student is given a chance with a trained professional, of course under supervision, because we don't want to leave fresh students, patients in the hands of fresh students. So to enter these scenarios, to enter the shoe dealing with this patient, with the diagnosis, the communication, etc. So then the person one learns how it's done in the real life. How do you communicate with patients? How do you not only treat the disease based on test books, but how you practically apply it in real life? What challenges come? How real life scenarios are different? And of course, they also come to know what is their temperament. If they are not liking the surgery assistants, they are not liking the radiological postings, neither the loving pediatrics, then maybe they are meant to be a pediatrician. Maybe they would turn out to be a very good pediatrician. And then we won't have these wrong subspecialty syndrome, that a person is misplaced into a subspecialty for which he never had an asset or a knack or a temperament for, and because of which he is not performing. Either he is not performing or he is not happy uh,
Mm.
while doing that kind of
How often does that happen?
work.
The incorrect subspecialty work. How often does that happen? Where people are not really
Uh,
happy or not able to perform.
Yeah, that happens very often. Very often. I would say at least in my peer group, at least just 30% uh, had chosen subspecialties where they are not feeling the most happy, where they are not performing to their most potential competence that could have come. And this I'm talking about 2006, where we of opportunity for getting exposure of all these subspecialties. Now I am pretty sure the statistics may be double or even more, where this kind of exposure is not there and everybody is just interested in clearing the next entrance and the next and the next.
Hmm. Yeah, yeah. And a lot of that also has to do with these online tuitions that are available, right? Anything, all
Yeah.
classes, all notes are all available online. They don't even have to go to class anymore. They can just stay at their rooms and just the study and the crack the exam. Yeah, it's actually a
Recently,
balance.
yeah, I recently visited my hostel where I was from the year 2006 to 2011, and across the lobby, and finally I reached the room where I wanted to meet a junior who had invited me there for a particular discussion. And I just asked him that, is there some event in the hospital, because not a single I can't see a single student in the corridor, or neither in the lobby,
Mm,
nor the sports complex, nor the indoor stadium. So I don't see anyone playing anything. I don't see anyone in the corridor. What's going on? Why is the hostel vacant? And he told me ki, no sir, the hostel is completely full right now, and there's not a single room where students are not there. In fact, the exams are not just around the corner, but yeah, they are maybe in a month or two, so maybe people are studying. But just switch on your wi-fi and you will come to know. And I switched on
mm,
my wi-fi, and on that particular floor, I was on the second floor of the ex my hostel building where I was an alumnus from 2006 to 2011. I found around 21 wi-fi's on which you
mm.
can connect. And
Yeah.
then he told me that each and every room has their own separate Wi-Fi. And there are some individuals in the same room, two students have two different Wi-Fis. And everyone is logged in for their digital courses and their studies for preparing for the entrances. So this is the state that we have reached now, that all the education is completely on online platforms, and right from the first year of MBBS, they are connected to these courses, and they are bombarded with the same message that the earlier you start, the more chances you have of cracking the exam when you reach the sixth year. So actually, first year itself, they take access to these courses, pay for these courses, and as soon as the clinical hospital, they come back and they log into their Wi-Fi's and their courses and they start. So that is the sad state now.
So is this a business propaganda, or is this, what is this? Where is this coming from?
Uh,
This idea that you start early and you stick to your screen and don't worry about actually learning in the field.
I see it's both. One problem is that education has become to some extent a business propaganda. There's we are seeing that with even pre-primary and primary subjects where these different apps and courses are coming in, and education bodies or educational institutes are being sold for a net worth of some crores to another institute, and we are all seeing this all over, not only medical but yeah, many other places. So definitely that is one part which has started since more and more rather than more and more teachers coming into this profession, more and more corporate houses are entering this space. But besides that, it's also a need or a demand of the hour. So even when I was doing internship, many of us were doing the internship part very diligently or very religiously. With
Mm,
a lot of labor, lot of hard work, because we knew that whatever we do, we will learn a lot of skill sets here, right from putting a basic IV cannula to taking shots. And but we did have a few percentage of our peers who wanted to skip all of this and just sit and prepare for the entrance so that they get a early hand over us. And it did help some of them passed right in the first attempt as soon as internship got over, and many of us had to take a second year break, study for some time for the entrance, and then clear it in the next post graduation. Unfortunately, the post graduation entrance does not have any testing of your clinical subset that you learn. So even if you are a master surgical assistant, or you have a lot of skill sets like taking putting IV can, no marks for that. The only marks are for the MCQs that you take. So amongst the four available theoretical options. So so practically, I may be the best at treating a patient despite just passing MBBS, but that doesn't hold value. The value is for whether amongst A, B, C, D, my option of MCQ is right or not. How common that disease is, or whether I'll even see a single patient of that type in my life. But yes, if I have the answer right, I clear, and the other one who has a clinical knowledge doesn't. So
mm,
so even then, there was always this culture where a few percentage always wanted a early jump start and an advantage over others, and it did benefit them in getting a better seat or a better rank in the board, early seat rather than wait one more year. And that kept on translating and escalating. So while we were in our internship, we learned that now people are starting right in their final year MBBS. 1 year later, when we were about to give our entrance, we learned that people are starting right in the second year MBBS. When today we learn that people, as soon as they enter first year, they first enroll the course on day one, make the payments, get it on their digital apps, install Wi-Fi, and then enter the hostel. So this is how it's going. So more and more competition is make pushing students and their parents to go for propaganda, and the pressure is always there where more and more in buy this, you will be left behind. So everyone is started preparing on year one, and you are thinking you will prepare on year five. So you're losing 5 years of preparation. So think how much you will have to compensate later on. So you won't be able to get any rank in the entrance. The reality is far from that, but yes, this is what is taught, and because of this, I don't blame anyone. No wonder students are actually falling to this and just entering that space right from the first year.
Yeah. So, in the long term, how does it matter? What is the effect of getting a year's worth of head start for a PG student in the long term?
See, it actually that is the start of a whole bunch of problems that we are seeing. One, as we discussed, they are not getting any clinical exposure. They are into their courses.
Mm-hmm.
Second, so they might end up choosing wrong subspecialties, which is such a wrong thing. A person who is meant to be a pediatrician, if that same person becomes a psychiatrist, it is a abomination for the patients as well as the hospital and healthcare industry, as well as that person's primary personal space. A psychiatrist is meant to be a psychiatrist. His psychological behavior, his thinking would be always to understand the psychology of the patient and add to that. So, that leads to a lot of doctors who are in a space where they either don't perform well or they are unhappy. So, that is one. Second, because these students are all into the MCQs and the studies, so right from the first year, they really don't pick up the other skill sets that are required for going out and treating patients. They don't learn networking, they don't learn communication and counseling, and these are very important. You may be a fantastic surgeon, but if you cannot explain the patient the benefits and the potential risks of the procedure, and if you cannot convince them that despite the potential complication risk, doing this procedure is the best thing in their interest, then you won't be able to operate or get conversion of patients on table, even if you have the best competence and even if you have the best ethical interest and patient centric nature. So these skill sets are much more important than anything else. In fact, nobody is being taught qualities like leadership, like uh, taking care of your colleagues and your junior staff. So where will this skill set come from? So if anybody wants to even establish a hospital and he has just come from a space where he's into apps and books and MCQs, he doesn't have any other skill set that is required.
Mm-hmm.
And yes, of course, the world is changing now. Even in technical interviews, the HR looks more into your leadership qualities, your digital skill set, your networking, your so all these. So these assets, these lifestyle skills are much more important now than just basic. And of course, we always say this that diseases don't read books. uh, you might have a patient who has come with classical symptoms of COVID, but his RT-PCR is negative. And because the RT-PCR is negative, the patient says, I don't have COVID. Why are you treating me like a COVID patient? And unfortunately, the COVID virus doesn't read books that it is supposed to come positive in a nasal swab. So then you have to use your clinical skill set and not just bookish knowledge that RT-PCR positive means COVID. And you have to explain the patient that clinically, radiologically, you are a COVID patient. So despite having a false we still need to treat you so that you don't progress. So all this knowledge of real life scenarios which are much different than what the textbook says, this only comes with practice and with actual patient engagement. So so that is what is lacking, and these are the consequences of this kind of a system that is there.
Hmm. So can we not get that practical exposure and also build those skills after we get into PG? Because that 1 year,
See you,
because you see what I'm saying, right? Because that 1 year I missed on that PG, sorry, on that
yeah,
experience, I can recoup that
yeah,
1 year after PG. No.
right. See, problem is that uh, one, the start is wrong. They are already into a subspecialty which they might not be meant for, or
Mm.
they don't have the temperament for. But let's say they do end up in the right place. Still, the same culture is now carried forward in the PG itself. The PG load
Yeah.
itself is humongous. Our post graduations in most government or uh, teaching institutions,
Yeah.
private institute, the overall workload is huge. On an average, the students or the postgraduate trainees work between 12 to 18 hours sometimes. And sometimes they're on call for 48 hours without sleep, with very little time to even have their food. And with that kind of a workload, again, the next thing in their mind is after PG, if I go out as a general physician, not have a survival today because everybody wants a subspecialist. I have to crack the next entrance, which is for my subspecialty, which is for a MC
Mm.
specialty DNB degree. So again, the same culture gets carried forward. He just has enough time to and maybe one vacation or one holiday after a week or 14 days, and in that he is again into buying courses for the next entrance, which will bring him into a subspecialty. And when he enters into a subspecialty, immediately he's told, okay, subspecialty you have, but there are thousands of urologists out there, so what makes you different? Go to Germany, get a fellowship, go to Korea, get a fellowship, learn robotics, and only then you get the edge, cutting edge. And so immediately he's for his next entrance and he's applying to international universities, emailing them and asking for an opportunity to come and get a observership or a fellowship for robotics. This is unending. And after all this, after giving around 14 years for his education and getting at least one subspecialty degree and two to three international fellowships, when he comes back, he's told that, oh, you have, it's good that you have, but in terms of practical experience, your experience is zero because you have just completed your last part of fellowship or education, which is not an independent work exposure. So you come and train under a senior specialist who is not a subspecialist, who is, or maybe a basic subspecialist without any international degrees, but yeah, he is into the market from 14 years. So you
Mm.
get under him along with many other trainees who are there in line and hierarchy before you, and we will give you a basic payroll of, let's say, a 4 salary. And because you are coming to us for observation, for learning, for growth, and you're not really adding to the patient revenue or the system, and or you're not bringing your own patients, and now you train under him, and then let's see, 5 to 6 years down the line, if we feel you are amongst all those trainees who has really picked up well, we may consider shifting you to a attending consultant and even think about a 6 digit salary or 6 figure payroll. So that is how, that is the practical thing that happens. People come with so much enthusiasm from getting at least 3 different international fellowships, and they come and they feel, yes, we are into robotics, and now I know the state of the art technology, and I have done most amount of surgeries outside. And when he comes back, he learns that, okay, no hospital, big, the smaller hospitals are not ready to invest into this kind of a infrastructure, and the larger hospitals which have invested, they already have people at the top of the hierarchy who are all into the 60s and 70s. Patients who are only coming by their names, patients do not want any junior person touching them. And because the junior person is coming for learning and for growth, he is not contributing, so that is his financial offer which is given. That is how they end up. And if they think of putting up their own setup, that is virtually non possibility, because setting up a hospital on top of that, such a high infrastructure with robotic implantation and everything, without having a patient base, because you're just a fresher who has come, it is be bankrupt, and he won't get any patient for the next 5 years until he starts establishing his own practice and starts getting a patient base. So this is the harsh reality that is there.
Yeah, yeah. No, that does make sense actually, and it's very. I can draw the parallel from my background in engineering, and it's very similar to what engineering is
Hmm.
also. When it comes to starting your
Right.
own setup or actually just graduating and getting more and more degrees, but still
Hmm.
it's way tougher with doctors because there's much more sensitive and intricate in most cases, right? Um,
Yes.
so it seems to me that there seems to there is an underlying challenge of lack of self-esteem or lack of
Hmm.
self-faith where somebody would not want to go and learn and fail and learn from experience, but depend on degrees and just passing a mark, and just focus on getting theoretical knowledge and depend on degrees to help them raise their quote unquote value, right? Do
Yeah.
you see that? Uh, uh, do you see that happening a lot with medical students and young doctors as well, or do we have more support and more moral and personal development for these people happening right now? What do you see?
No. Uh, of course, I wouldn't want to make this session into a demotivating session for young
Yeah, yeah,
medicos.
yeah. That's
So
so.
I will say that, yeah, no, no, means all what I might mean to say is yes, what we have spoken is all truth. These are the practical things which we want these students to know and grow. Uh, Besides, of course, their studies, which is important. They need to get a rank because without that, all this is of no use. But things are changing. I would now come to the positive aspect, which is happening very dynamically. So, besides all these challenges, one big challenge was also awareness,
Mm,
because still a lot of patients in the tier 2 cities or districts are not aware of solutions to problems. Like my own intervention radiology, hardly anyone knows about it. A person with an I just today in this past week I have operated 3 patients with enlarged prostates, because of which they couldn't pass urine. They had to be catheterized, and now they can only pee with a catheter inside their urinary bladder. So the operation for them, urological surgery, where the urologist goes in and does for such large prostates a HOLEP procedure with a holmium laser, where they shave off a lot of part of prostate and try to give some space to the urine to flow so that the catheter can be out. But with such large prostates, it's a very difficult surgery, and it's a long surgery. It requires general anesthesia. 3 days go with a lot of morbidity. But I could treat these patients with a small pinhole in the wrist, and
wow.
all I did was go through the wrist, take a wire and a micro catheter under X-ray vision to the blood supply of the prostate, and just knock off the blood supply. Just with special particles, stop the blood supply, because of which the prostate did not get blood anymore, and it started dying. Because it started dying, it shrunk, and within 14 days, we could remove the catheter in most of these patients.
Wow.
So this is one awareness which no one is aware of either, especially I would say 99% of our patients are not aware of. So
Mm-hmm.
even such challenges are there. But all being said, the challenges that we discussed in terms of growth and patient acceptance and networking, and the awareness challenges, things are changing in a rapid way. I can see a lot of my young peers coming together and collaborating, which has empowered them to overcome these challenges of trying to set up their own infrastructure and the heavy investments without really starting even. So, and the power of collaboration is when you have different 7 subspecialties all competent enough, and the brains come together and set up something. One, the patients see faith in such an institution because they see that not corporates but doctors are running this show. So the ideology is different. It is not to generate revenue, but it is to actually help the patients with whatever skill sets they have acquired up till now. Second, of course, so many brains come together, so there is a lot of input from each person. Somebody is a good leader, a person is a good networker, a person has a good B2B relationship, a good PR, a fourth person has a good digital knowledge despite being a doctor. So all of them come, and these kind of institutes are coming in now, and that has also reduced a lot of unethical things which were going on in few places. So there's no need of a referral based pattern where they need to do something unethical to get patients, because all of them can cross referral, because understanding that each doctor is competent and also cultured and ethical enough, so the patient they are sending in good hands, and it's going ultimately to the same institute which is their joint venture. uh, Besides this, there are a lot of educational institutes where the newer professors that are coming in, they are uh, of this understanding that you can't be in this hierarchy system and you can't keep this hierarchy system alive. If there is a junior person who is very enthusiastic and very active and has a particular skill set, they are actually giving uh, a good resources and good time to allow his potential to develop. So things are changing a lot, and I would definitely uh, like, of course, it's still in the initiating phase, and we would like to see this expand to each and every institute. But yes, things are getting more and more standardized. Our government bodies or the medical bodies that are there, the curriculums are getting more and more standardized, more and more defined. Research has become mandatory before you pass out and you come. Few clinical logbooks where you have adequate hours of exposure for few patients have become mandatory. So yes, the authorities have started recognizing these issues that have come up, and they have started working towards the solutions. Of course, they need to be escalated. They need to become uniform all across the country and all training programs. But yes, we are seeing a significant change. Another major change I'm seeing is, yes, patients have left that notion that we only want senior doctors with gray hair and a lot of experience. Patients, I do see a lot of patients. I being a doctor in his early 30s, I get a lot of patients, and with good counseling, with good communication, I do see a lot of faith and trust which develops with that counseling session. Even with my digital awareness campaigns, many patients see those videos, get aware or educated about that kind of novel procedure, and they do come fly in all across from different states and get operated by me, just based on that counseling and that communication. They understand that yes, what he's offering is medically sound, and so that faith and that connection develops, and they do travel all the way to get operated. So yes, we are seeing a lot of changes, and hopefully this should expand and become more uniform, and the space should become much healthier for doctors, young doctors now than it was before.
Yeah, yeah, absolutely. No, that's great. Amazing. Thanks a lot for giving that turn, that upside to how things are changing. And yes, there are challenges,
Yeah.
like you said, but there are also solutions that people have figured out. We just need to scale
Yes.
them and escalate them further, right? So that's the reason
Yes.
why we are here. And that's one of the major goals of Healthful Diaries project as well, that we want to make sure we find solutions to what problems are, and then we want to
Yes.
escalate, then bring more eyes to those solutions. Awesome.
Yes.
Thanks a lot. Think, it's a good place that we can conclude this session. I truly appreciate your insights, the your answers and the things. There are too many things that we talked about, and many more that we can. So we would really love to have you again for maybe a podcast or another live session sometime. Until then,
Sure.
please keep doing the good work, and let's stay in touch. And give my regards to your family. Okay.
Thank you. Thank you so
Awesome.
much.
Thank you.
Yeah. Happy Doctor's Day to all of you, because
Yeah.
if it's not for the patients and the non-medicals, it's not for the doctors. So
Yeah.
we are only appreciated. We love our profession, but it is all due to patients. So in the end, of course, when a patient is not happy with the outcome of your treatment, despite best of your efforts, it does hurt. But then the 10 patients who appreciate, who express gratitude, it gives a lot of encouragement. So Doctors Day, of course, with going and revisiting our oaths and trying to be more patient centric. Along with that, I think for me this day is very special because I always go within and express. I am very grateful for the acceptance that patients have given me, for the gratitude that they have expressed, for the gracious behaviors that they have executed in accepting our treatments, in accepting the complications, and even despite those complications, with a smile, trying to thank our effort rather than the outcome. There are
Yeah.
patients like that, many of them. So yes, thank you for this opportunity, and Helpful Diaries, like our last podcast or like today's session, I see how it is always intending to bring about a positive change in society, along putting a highlight or a spotlight on the insight of doctors besides their workspace or besides their professional thing, rest of all of their aspects. So very grateful for this initiative, very novel, very
No,
unique,
thanks a
and
lot.
very important.
Yeah,
Yeah.
thanks.
Thank you.
Appreciate that. And it's only because of you guys. Thanks a lot. And happy National Doctors Day again. Okay. Take care. All right. See
Thank
you.
you. Yeah. Bye. Bye.